Russell.
Thank you, Mr. Speaker. Dr. Carly Mellor, an NHS dentist in my constituency, spoke to me recently, and I quote, "Ministers pledged to fix the failed contract we worked to within this Parliament. The government has begun discussions on a new contract and promised a public consultation on it this summer. A typical dentist delivering NHS care does so at a loss. With every passing month, more practices are reconsidering their future in the NHS, while millions of patients continue to struggle to access care. Reforming the contract is the route to better treatment for my constituents. Please can we start the consultation without delay?"
Prime Minister.
Can I thank her for raising this? I'm pleased that we've delivered over 1.8 million additional courses of NHS treatment, because no one needing urgent care should be left in pain and waiting for help. Mr. Speaker, we've already made early reforms, including embedding urgent care into the contract so people get fast access to NHS care, and delivering the first sustained expansion of dental school places in nearly 20 years to get extra dentists trained. We will consult on a reformed dental contract soon, and I'll make sure that ministers update my honourable friend.
Thank you, Mr. Speaker. In Ashfield, 4 workers, including 2 nurses, were kicked out of their HMO, and Serco put 4 illegal migrants in this HMO. One of these illegal migrants was a Pakistani national. He went on to rape a young girl, a vulnerable young girl, on a park in Ashfield. He's now doing 14 years in prison. This was a monster allowed into this country by this awful government. But if the Prime Minister is really serious about protecting young women and girls, does he agree with me and Reform UK that every single illegal migrant coming to this country should be detained, not allowed to claim asylum, and then deported?
Prime Minister.
Mr. Speaker, I'm very proud of the fact that after net migration reached almost 1 million under the party opposite, we brought it down by 82%. On the asylum system, which he references, now asylum decisions are made at record levels, the backlog is down, removals are up 41%, and we're closing asylum hotels. They lost control of our borders. Now small boat crossings are coming down, and we deported 70,000 people with no right to be here. He likes to ask questions. He should be asking some questions of the leader of his party sitting next to him. He received £5 million in crypto from a crypto billionaire, and then privately lobbied the Bank of England on digital currency. So did their leader carry out lobbying paid? Why did he keep his £5 million gift secret? And I'm happy with their leader earning £20,000 an hour flogging gold bullion. They need to ask the questions across their benches, but they never do.
Mr. Speaker, too many people are waiting too long for NHS mental health care, with over 6,000 adults waiting up to 2 years. In Sunderland, grassroots organisations like the wonderful Betsy Jenny Cafe are providing support to our community, but they cannot substitute for timely NHS-funded care. So as the government consults on its new mental health strategy, will the Prime Minister agree with me that it must include clear waiting time standards?
Prime Minister.
Well, I thank him, and we're determined to transform mental health so everyone gets the support they need. Mr. Speaker, I'm pleased to say that we've recruited 8,700 extra mental health workers. We've opened the first of 6 24/7 neighbourhood mental health centres, and we're ensured that nearly 800,000 more children and young people have access to a mental health support team in their school or college. There is more to be done, but this is a real step forward.